Good afternoon. My name is Dean Mazzarola, Mayor for the City of Leominster. Thank you for joining us. Thank you to the crew here at LTV for coming in. This is shown on a number of different channels through cable. It is also simulcasting on 95.1 WLPZ radio, and you can also go to their website, WLPZ.org, and click on them, and you'll be able to hear it through your electronic device. So this is March 30th. It is a little past 4 o'clock. We'll give you the update in terms of numbers. I'll read them a couple of times because people join us at different times of the briefing. Thus far, there are about 40, I'm going to rough these numbers for you, 43,000 people that have been tested. That's significantly higher than it was even yesterday. It's about 9,000 or so more than yesterday. There are 5,750 confirmed cases. There are 390 in Worcester County. There are 453 hospitalized in the state of Massachusetts and 15 confirmed cases in Leominster. However, I will, as a footnote, just say that some of those that were tested and listed as confirmed are now been released from that confirmation. So I don't know how they count that, if they continue to count that, but we have a number that have been released from the confirmed list, but we'll just leave that in there as 19. We'll try to get you some slides here. There's the important phone numbers. We read them over and over and over. The one that gets you everywhere is 978-534-7500, extension 0. Emergency Management, same phone number, extension 5055. You can also get Meals on Wheels through the Senior Center. Leominster Veterans Center is open. Statewide hotline is 211. And also the updates from the state is you go to 888-777. And to volunteer, if you'd like to volunteer and get on our list, again, 534-7500, extension 5055 is the phone number. And also if you need assistance of any kind, that's the same phone number. City Hall is open. Most of city government can be accessed online, but check our webpage. If there's something that you cannot access, by all stretch of the imagination, please let us know, and we'll get you that form. As I see people in the parking lot all day, people in and outside the building, same at the Veterans Center, et cetera. So those are all good things. The hotline for the school department, breakfast and lunch. Hotline number is 978-534-7700, extension 1341, and 7 to 10 extended hours now, 7 to 10 at Johnny Appleseed, Francis Drake, Leominster High School, and Fallbrook. If you can't get to those locations, you could go to Riverside Apartments, and I'm not sure where the other location is, Silverleaf, which is up off of Litchfield Street. And then if you can't get to those locations, by all means call us and we'll make sure you get a lunch. You can either come to City Hall and pick them up. If you absolutely can't get to any one of these locations, including City Hall, somehow or another we'll make sure we can get you those school lunches. Here are the cases as of yesterday. Again, they've gone up. It seems as though the testing is a little higher in percentages than there are reported cases, but that's a one-day sort of thing. If you look at the cases yesterday, there were 34,000 people tested in mass and about 5,000 people testing positive, or 4,257. So it's gone up, but it looks like the percentage of those testing positive has gone down. Now that doesn't really mean anything. I think from what I've been listening to on other press conferences is they expect it to go up in 2 to 3 weeks to peak out. So that's really a long time if we're going to be peaking out. So these numbers are just something that we're taking a look at day by day, but we are continuing to maintain a low level here in Leominster with 15 cases gone up from 12 as of Saturday. So I'm not sure, what all that means, and that's certainly not time to wave the white flag. It certainly is time to reinforce what we've been saying right along. There's the testing sites. If for some reason you have symptoms or some reason to believe that you should be tested, I'm not your doctor, call your doctor. There could be all sorts of reasons why. There are a couple times when I've heard of people having other illnesses not even associated with this. When they got to see their doctor, talk to the doctor recommended testing. So I'm not your physician. I'm not in the medical world. I'm just giving this information because you need to call a doctor, your doctor, a doctor, and need for them to fax over or email the doctor's order, or they will not test you when you get to Health Alliance or to Reliance. So make sure that happens. And 8 to 4 extended hours at Health Alliance, and also at Reliant, you have to make an appointment, and testing at Reliant is for Reliant customers only. A couple of things I wanted to highlight. I know the governor's, and I actually messaged it through Facebook and reposted it, and a couple of things I just wanted to highlight. They announced that he's expecting a 10-day surge, estimated between April 7th and the 17th. This weekend, the Commonwealth reached 40,000 tests. The state has reached its goal of 3,500 tests per day. The state received a shipment from the federal stockpile this weekend. The state should be receiving 1,000 ventilators next week or late this week. Beaumont Skilled Nursing Facility in Worcester will be open this week at the first COVID-19 facility. They will expect elderly COVID patients who are in recovery stage to free up a bed in the hospital. The state is expected to have 1,000 beds for this purpose shortly. So that will free up beds so that others that are more seriously ill could be left to the hospital and admitted to the hospital, where they have all the cutting edge and latest medicines and equipment. And then lastly, the state is currently looking at the president's extension of the stay-at-home advisory until April 30th for its impact on businesses. Announcement will be made tomorrow on the extension of April 7th. Basically, April 7th was the date that I think most were thinking about. Then they moved the school date till May 4th. And then, the president was on last night, and they're worrying about a reoccurrence, or sort of looking like the levels are, everything's leveled off. It looks like we can get back to somewhat of the temporary new normal, and then it comes back on us. So they've moved that date to the end of April. And so that was just a flood of questions for us today, which ended up back to the governor in terms of what will happen here in Mass, because businesses were pretty much thinking 2 or 3 weeks, then thinking April 7th, and now they're not sure at all whether or not they'll be able to open up slowly. So those are all things that we're trying to get answers to, and we will share that with you as soon as we get it. So the money for the stimulus has been passed. Here are a number of things to take a look at. The money is not available. So the regular funding for unemployment benefits in Massachusetts is available. So you should still you'll never get through. People that told me they've tried to call, you never get through. So get online, go to mass.gov. They'll take you through the steps. Go to Mass Hire, any one of those places, and you can do your application online. And then then I heard that somebody had done their application online, and the second they hit send, the system couldn't handle so many applications, and they lost the information. So now the state is saying download the information first, fill it out, and then either mail it in, I guess they're saying now, or electronically try to resubmit it. So it's probably a major impact on the system, and I'm not sure if they knew how many claims there would be, or if the system could actually handle it. Again, my name is Dean Mazzarella, Mayor for the City of Leominster. We do these briefings and updates every day at 9 in the morning and then 4 in the afternoon. So we try to take the mountain of information that we gather all day long, and we try to reduce it and make it as simple as we possibly can, and try to make it informative as we can in terms of localizing the information. Let's go to the stimulus package for businesses. They have what's called a Paycheck Protection Plan, an economic injury loan, an emergency economic injury grant. So all of this is available through the SBA, and also the local Chamber of Commerce, our North Central Chamber of Commerce, has just every link you can ever imagine. It's a great resource. The CARE Act summary for businesses, you can go to online at leominster-ma.gov. And so this weekend, Wendy Weeks, the grant writer for the city, spent a significant amount of time going through just mountain of information, trying to find the best place where a small business can find the most amount of information and find it organized and understandable and simplified. And again, if you go to our website at leominster-ma.gov and look at the CARE Act summary for businesses, it is the best document. I read through it today a couple times. I sent it out to a few of the businesses, asked them what they thought, and they were very encouraged by what they saw in terms of being able to sift through it and understand it. And it's pretty easy to use, and that will tell you everything you need to know if you own a small business. That's right on our website now. I was emailing people individually, but it is on our website at leominster-ma.gov, and look under the small SBA small business. There are a number of the other appropriations. This is what we're trying to get a better understanding for. $4.3 billion to support federal, state, and local public health agencies to prevent, prepare for, and respond to coronavirus. $45 billion in FEMA disaster relief. $30 billion in grants to provide emergency support to local school systems. $25 billion to aid in our nation's transit system. $7 billion for affordable housing and homeless assistance, and $100 billion for hospitals. Again, trying to understand all this and sift through it all, and as we get it, we will share it with you. Business questions, to localize it even more. Melissa Tasker's standing by at 978-534-7500, extension 3579. And then the Chamber of Commerce, they have a $20,000 loan program, mass.gov. It also has a list of information, and Mass Hire, all sites that you want to take a peek at. As the weather gets better, yes, yard waste, April 6th through the 30th. Leominster Water Department is flushing. I didn't get the updated list of where they'll be flushing tomorrow, but they were up in the Fallbrook area. I will post it on my Facebook page as soon as I know. Please consider giving blood. The Commonwealth has experienced a shortage of blood. Please consider giving blood by calling this number. It is the best thing to do, either to go to the website or to call 1-800-RED Cross. And you have to call to make an appointment. Much appreciated. You can support local businesses. These are all the businesses who are either have a virtual site, so you go on the website and they might have a camera set up where you can see the products they sell, or they have an online presence. And if you'd like to sign up for that as well, you can go to email Melissa Tasker at mtasker@leominster-ma.gov. Going on a bear hunt. I know some people have asked us, what's this all about? But anyway, people put bears out. You can put them in your house, on top of your garage, wherever, on the porch, wherever you want. And then we have a list, and then families get together, hop in the car, or go out walking and to see where all the different locations are. Kids' edition of these tablets, they need to be downloaded. But anyway, there's so much that a student can do on there. If there's anybody who would like to borrow one, give us a call at City Hall. There's the phone number, 978-534-7500, extension 0. Community resources, again, jump in. You could Google any one of these. United Way, Growing Places, fresh fruits and vegetables every Wednesday from 11 to 12:30 at the Senior Center parking lot, and then from 3:30 to 4:30, the corner of Mechanic and Laurel Streets, they take SNAP and HIP. Catholic Charities, including food pantries, their hours will be Monday, Tuesday, Thursday, and Friday, 8:30 to 4:30, but make sure you call 978-840-0696. Are You OK program? I'll go back one. The police department has this program for those who are medically disabled, senior citizens, or shut-ins that need to be checked on daily. Dispatcher will call every number at a designated time, and then if there's no answer after 2 times, they'll send an officer to check on them. So there's the phone number at the bottom, 978-534-7560, extension 43432. I don't know if there's a person left in the entire universe that this hasn't been stated to over 1 million times, but I'll try to give you my simple spin on it. Assume you have the virus. Assume everybody you come in contact with has the virus. Assume every surface that you touch is somehow or another been compromised. this virus despises soap and water, and it despises alcohol. And that's the simplest way that I can explain. We are a little cooler out today, so not as many in our parks, but we are trying not to close our parks. I'm going to just put that list up so you can see it. Here are all of the folks that made donations to the city in one way or another, and we really want to thank all of them. The newest was Todd Deacon found some masks that he donated to us, to the emergency management, and those were then dispersed out. And Piccolo Mundo today, Learning Center, Maria and Mike Cupo, who gave us literally a truckload of bagels. I don't know where they came from. They were fresh. They were authentic. I think each one of them was boiled before they were given to us, which is really the way to eat a bagel or to prepare a bagel, and came with cream cheese, and they went out to all those in public safety. They went out everywhere today. I've never seen anything like it, so thank you. But everyone else here on the list, all of the dentists in town and doctors and oral surgeons, Adams Tool, United Solutions, O'Connor Companies, Sue Zephyr and Ginny's Helping Hand, Jeff Richard at R&S Hauling, US PAC, AIS, and many, many more, and we'll just keep adding to that list. Free Wi-Fi at the library, public library. Just go out back. You'll see the little sort of connection pop up. It says Leo Lib Guest, and there's no password. So just pull in, and there's a row of parking spots in the back there on Pearl Street to get you hooked up. Senior shopping, best is everybody has some sort of senior shopping hours now. Best thing to do is call ahead and see what their hours are. Restaurant takeouts and delivery, these businesses, this is a way to help them out. A lot of them have chosen to, some have decided to close, but some just really need the help and need the funding, and they're going to just stick with it as long as they can. And so again, we don't know what that date means that the president talked about. Governor's going to comment on it tomorrow, and we'll bring that information to you. So we didn't, as I said, we did not want to close our parks. We want them open, just don't use the equipment at our parks. That would be helpful, and we can keep them open because from what we're hearing at the rec department and others making observations, it's pretty clear this is the most amount of people we've ever seen on our trails and using our parks in any one given time. We have 26 miles of trails and dozens of parks, and we want you to use them. Don't forget your census. I know I keep sort of everywhere you go there's a commercial about it, but please don't forget it. And don't forget 95.1 FM streaming on WLPZ.org or on their Facebook page. I know that they share it as well. Everybody's supposed to have a daily designated shopping time for seniors. It has been mandated by Governor Baker. So yes, if that's the case, that's why I said the best thing to do is everyone has one, so just call to find out what their hours are. I started to list them, but there was just too many places at too many times. And then if I got a Tuesday and not a Wednesday, then somebody was upset, and I'd get a phone call from the business. So the best way to do it is to just say anybody that's open has special hours, therefore you should give them a call. Our big push, as I said this morning, our big sort of push is getting into the hands of students electronic devices as well as a internet access. If you didn't receive an email, if you use Verizon or some of these other carriers, check. Go to their website and check, because most of them have added data to your plan temporarily. Therefore, if you need to hook into a school site or an educational site and you're using more data than you typically are, I think you should look and check, because, Verizon, I got a number of those on my phones this weekend about how they've added extra time to my cell phone or my data plan. Some are unlimited, and we're trying to hook up with both Verizon and Comcast to see if we can't get more hotspots that we could borrow and get them into the hands of students and families that don't have internet access. So if you don't, I know the school department did a big push on it this weekend. If for some reason you know somebody that does not have an electronic device and or internet access, let us know, because we really have to get down to more on the education piece of this. We've got to get more structured educational times for kids to learn. I know this is something that teachers No, package stores are open. And I know that this is something that is important to the teachers because they work so hard all year with their lesson plans, and they want to see the students continue on with their educational piece. So, and we want to help them do that. So that's the big push this week. And so a lot going on in the city. We're trying to take all of the information that we're getting from the federal and state governments and trying to get that all to you and get it sort of simplified as much as we can so this doesn't become painful for you. I think in just listening to most and receiving the number of messages I received over the weekend is people are in information overload. Take a break from the press, take a break from the news, just sit it out for a little while. It does get overwhelming, and then it gets to the point where you're not sure what to do first. And that's where I think we could be most helpful is we can reduce all this, gather a mountain full of information, reduce it all for you, and then share it with you. Again, if you'd like to donate blood, please call the Red Cross first. It's always best at this particular point not to just show up anywhere. Everyone is doing everything by appointment, but that's really a good way because it's really a good method simply because it doesn't waste your time and put you in a line where then you could be exposed, and it helps them to sort of get things in place so they know how many people are coming and at what time, so they can make better use of your time. So May 4th is the earliest that we'd be back in school. April 30th is what the president had done a reboot on. And I know, and I listened to that speech, and I know sometimes people get real critical, but I think he was trying to be hopeful. And he said, wouldn't it be nice if we could see Easter Sunday and see everybody in the churches and everybody dressed up and families getting together again? But it doesn't look like that's going to be realistic at this particular point. But we do have to be hopeful for a lot of things. And just speaking with, the Starburst Committee, and, they put on, for 20-something years, almost 30 years, they've put on Starburst over at Doyle Field. And they work so hard all year. First email I get in January 2nd is from the Starburst Committee. They work 12 months a year to make sure they put on this spectacular event over at Doyle Field. And, there was a thought, do we just cancel it this year? And you know what? We've got to start putting hope back into, the community because we should have that event. And they're looking at maybe August now, and maybe it gets pushed out further than August. Maybe it gets pushed out to the end of August. We've done that in the past, maybe the beginning of September. But I know things are put on hold for now, but we shouldn't stop planning. We shouldn't stop having hope. And I know people want to get back to church. It's not the same for them to watch it maybe on TV. It's not the same feeling. There's a lot of fellowship that goes on. Many of the great events that happen here yearly here in the city of Leominster, Employee of the Year. There's just a host of things, the Wizard of Oz. I hope the students at the high school continue to use the greatest technology we have at our fingertips to continue to practice and rehearse. And then maybe this summer we'll provide a forum for them to perform The Wizard of Oz, my favorite of all movies. I've said this a couple times now for the class of 2020. It's not a time to sort of give up. It's really the time to connect using sort of technology as your social means and get together and start brainstorming about how you can still have your prom and graduation and, take control. This is your year. 2020 is a very special year. I've been listening to you for the last 3 years talk about, how exciting it is. And 2020, just think of it, right? We all made it to 2020. And so it's an important year. And even though, the virus will be something that'll be associated with, make spectacular plans. And if we have to shut down downtown and have it, your prom under the lights, we'll do whatever's necessary. We'll make it happen. We'll work with you. But don't give up and, start thinking. There's, we're into this now. Looks like, another month, could be another 2 months. But good weather is coming, and make good use of that. You've got the time. Start the planning process now. Put plan A, B, and C together. Somebody's asking, I've been sick, not feeling well. Call your doctor. That's the best way. They're going to ask you a series of questions. Based on those questions, they may want to see you. Based on those questions, they may just send you for a test. But you can't just show up for a test. They need to know that you're coming, and you need to be entered into the system. And then the test results will be shared with the state and also with the local Board of Health. However, you must call your physician. Yeah, well, I don't know. Why shouldn't we consider the class of 2020? I remember we graduated in 1975 with one of the largest classes to come out of Leominster High. And I remember we were all bummed out because it rained, and instead of having it like everybody else had it, we had it in the auditorium or the gymnasium. I forget which one. But I remember that every student got one ticket to get in. I think it was just one ticket to get in. And, you know, the whole thing was, at the end of the day, we made the best of it. And you know, there was the year that the fields were under renovation at Doyle Field. And this is actually one of the most memorable graduations. And they had it at the Centrum at the time. It's now the DCU Center. And it was, you know, when everybody left, they were like, you know what? This was pretty cool. We had a lot of fun. So students, take control. This is your chance. Whatever it takes, I know the community will back you. They want to see you have a good time. They want to see you have a memorable experience and one that's unforgettable, right? So under the stars, wherever you decide to do it, we're 100% behind you. I know I can get the backing of the community to help you out. So you know, use Skype, Facebook Time. There's Zoom. There's just so many different applications out there where you can stay connected. Just because you physically can't meet doesn't mean you can't have meetings, right? So get going on that, put a plan A, B, and C together, and we're here as your partners. We want to make it a special 2020. And I do feel bad, though. I mean, for the families who have lost loved ones and they couldn't have funerals or wakes or even church services. I know a number of them are going to have a day of fellowship at some other time. But it's a little bit sad. There's some people I knew really well, and you want to pay your respects. And so that's where maybe sending a card or something special or sending some food over or whatever it might be, you know, sort of touches them and gets them through some difficult times, right? So we are just about out of time here. I've tried to read through the questions here. In Leominster is going to continue to report positive COVID-19 results to its citizens. Yes, we do every day at 4 o'clock, and we do the same at 9 in the morning. There are 15 today. As of today, that's the updated number, although the health director tells me that there are some that are coming off of that list. But just for the sake of conversation today, I don't know if now that some have recovered, whether we're going to get a list of those that tested positive and then another list saying these are the ones that tested positive but have recovered, so therefore they should technically come off the list. Either way, this isn't going away. This isn't to somehow or another suggest that Leominster hasn't been hit hard by it and that we can sort of loosen up on our restrictions. Absolutely not. It means that every one of us has to sacrifice, that every one of us has to protect ourselves and those around us, and you're doing everybody a favor by keeping your distance. And I don't know, you know, nobody commented on my observation about it appears to be, it's just my own observation, that there seems to be less people with colds. I don't know if you noticed that, but there seems to be less people with less colds. And I'd suggest that probably after all of this, we're going to realize how certain amount of distance and taking care of ourselves and not going to work when you're sick and all of those things are really going to help. Proper hygiene. I think these sorts of new way of thinking, a new way of life for us, everyday life changes, but maybe to some extent in a positive way for future you know, viruses and flus that we have. And so, yeah, maybe that does make the difference. Thank you all. We want to thank those in the medical world, every single one of them. I know I had a couple of friends myself that were in quarantine, self-quarantine because they had certain symptoms. They were tested and they were found negative. It's very scary for them. Everyone in the business will share with you that people that come in sometimes with just minor symptoms within hours are in the intensive care units. And so just yesterday, last night, forget, it's all a blur, we received information that Life Care Center didn't have masks. And so first thing this morning, Emergency Management Director Jim LeBlanc, who's been absolutely phenomenal, him and his whole crew, fire, police, EMS, everybody's been just fantastic. Senior Center, everyone, city employees, DPW, everybody's been just excellent. So he was able to get those masks up to them, and what a difference it makes. So let us know if there's a shortage somewhere or something. I know people will, sometimes we get a phone call and we hear that somebody needs supplies. We call that organization and they say, no, we're actually right now we're all set. So if you know and you've heard that somebody needs masks or certain supplies, let us know, and we'll call just to verify that. And if they need help, we'll get it to them as soon as we possibly can. Our Emergency Operations Center is at 37 Carter Street, and that is manned and staffed from 8 in the morning till 8 at night by volunteers. But Emergency Management has 2 full-time staff members, but we're available 24/7 if you need something. So again, pass that information along. Yes, how could I forget those grocery store employees? I don't understand how more of them haven't contracted the virus. I know there's shields now in a lot of the supermarkets. That's excellent, because that's really where I think people were getting it. They were so close to each other. And so yes, those people that work at the gas stations and banks and, all the essential employees that show up. And, some of the people that work at some of these locations aren't making a whole lot of money, yet, they show up every day of the week so that we can get into that convenience store or get our gas or do our grocery shopping or get the essential things that we need in our house, especially since we're home now. Speaking of the fact that people are home now, here's what we've noticed. Trash. A lot more trash. People are generating it. They're home, generating a lot more trash. They are trying to self-quarantine, trying to stay home. And as they do, they're cleaning closets, junk drawers, basements, all of that. And they're trying to get more of that out into the regular trash. We're thinking about how best to do that, but I can tell you in the meantime, for $3, you can get a bag this big. You get 5 for $15 over at the health department. If you call, they'll bring them out to you. And let me tell you, you can fit a lot of stuff in them. And we're trying not to relax the rules as we speak because of what might happen, and it could end up being. I think we might already be over. Based on the last month or so, we might already be over what our budgeted amount was. And so we don't want to just open it up and say, put whatever you want out there and then end up with a huge deficit just because we don't know what the financial status is going to be in terms of that account at this point. But we know we're running over, and we'll analyze that this week. So the best thing to do is recycle as much as you can. If you need overflow bags, they're $3. And it's not $3 for a 30-gallon. These bags are pretty big, and anybody that's used them is, the feedback's been great. So if you could do that, handle it that way, I think you'd save us all a lot of money, your tax dollars. So try it out. We'll see how that works, but we realize that more and more people are home. Hannaford's on Lancaster Streets have some of the finest human being employees. They go out of their way to help you. Thank you. Do you know if homemade masks can be used? Because some people are saying they don't help. Some say they do. I really would be, I don't want to answer that question because I think there are a whole host of things that come into that equation. Who's using them? What are they using them for? I know that some have tried to use, to donate those masks to some of the hospitals or urgent care centers, and they wouldn't accept them for whatever reason. So the best thing to do is call and find out if there's a place that needs them. If you want to donate to a hospital or a nursing home, whatever, find out if what you're making is acceptable to them. That's the best way that I can explain it at this particular point. So I want to thank all those in public safety, everybody here at LTV, 95.1 WLPZ, our staff at City Hall and all municipal buildings, police and fire and DPW workers and everybody in the city, all those in the medical world, all those in essential services, thank you. You're important. We realize how important you are, and we appreciate it. We'll check in with you tomorrow at 9 o'clock from City Hall, and we'll do another update. We'll update any new information that we have as well as any new numbers. Ask the doctor, yes. Ask your doctor about everything, because especially about the mask, because I'm not sure. I've heard some people making masks and certain doctors accepting them. Then I've heard that they try to offer them to hospitals. They wouldn't take them. So it's all over the place, and I hate to be the one Interesting. There's a couple of comments on here you want to sort of read. My daughter called in sick with a toothache. They told that she had to get a doctor's note to come back. So all kinds of things. These are the things that crop up to us all day long, and we try to get answers as fast as we can. But for these questions, again, call your physician or somebody in the healthcare industry, or call, if you want to donate to a particular agency, call them and ask them if they would accept a certain kind of mask. Okay, thank you for watching our briefing. Again, we'll see you tomorrow morning at 9 o'clock.